What if cancer isn't just something that happens to your body, but something that begins in your nervous system, in your unresolved grief, in the stress that you learned to survive, in the electromagnetic field that's pulsing invisibly through every room that you've ever lived in? Well, today's guest has spent years in clinical practice asking this uncomfortable question. What if we've been treating cancer too narrowly? What if we keep addressing the tumor and we leave untouched the conditions that allowed it to grow? My guest name today is Brandon LaGreca. He's a licensed acupuncturist, an integrative oncology expert, and the author of 3 books that tackle what most oncologists don't want to talk about: the role of trauma, the role of chronic stress, and the role of the electromagnetic radiation that is surrounding every waking moment of our lives. Oh, and he's also a stage 4 cancer survivor. So he doesn't just know this intellectually, he knows it from the inside. And what he has to say connects in profound ways to the work of Dr. Nicholas Gonzalez. Because the Gonzalez protocol was never and is never been just about diet, detox, and pancreatic enzymes. It's always been about the whole person. It's always been about the autonomic nervous system. And it's always about restoring what has been broken at every level. Today, we go deeper. This is your way back. Brandon LaGreca holds a master's degree in acupuncture and oriental medicine from the Oregon College of Oriental Medicine. He spent over a decade in private practice before receiving his own diagnosis of stage 4 non-Hodgkin's lymphoma. 8 months later, following an integrative protocol that included immunotherapy alongside natural medicine, he achieved remission. Well, that experience changed what he researches, what he writes, and what he asks cancer patients to consider. He has since authored 3 books: Cancer and EMF Radiation, Cancer, Stress, and Mindset, and his most recent, Cancer, Trauma, and Emotions. Together, they form one of the most comprehensive explorations of cancer's non-tumor dimensions available today. Well, welcome, Brandon. Now, before we get into the books, can you please tell us what your own diagnosis taught you that a decade of clinical practice had not?
Yeah, sure. Thanks, Mary Beth, for having me on. So I was diagnosed with stage 4 non-Hodgkin's lymphoma. And as you just mentioned, that happened 10 years into my private practice. So by that point, I was already pretty well established, as a mature provider. But I think the thing that my diagnosis really offered to me was the patient perspective, right? I mean, what does it really truly feel like to be told you have cancer and then to be told later on you have a stage 4 diagnosis? So, what's going on emotionally? What's going on spiritually? It brings up all these thoughts about your own mortality. So, these are things that I kind of knew tangentially working with patients, but it really wasn't the same until it was just handed to me in that way. So, I think the entire patient journey is what I took away from the whole experience. So of course I academically kind of knew and dialed in with my colleagues an integrative cancer protocol, but to really understand what's like to be the patient, to have the symptoms, to have the ups and downs, that's what I really took away from it.
And you're very forthcoming, I would imagine, in your patient conversations about that fact.
Yeah, absolutely. In fact, it's now my superpower where I can talk with a patient who's been recently diagnosed and I can get right into the thick of it with them. Like I know maybe the dark place that they initially go to and try to pull them out of that, or maybe try to pull some of their agency out of where they're at to try to restore their own empowerment. So for me, it's just now ability to empathize very deeply And then from that place, really be able to walk the line between, here's the medical side of things, but here's really the truly patient-focused way that we can do this in the most holistic way possible.
Well, let's talk about your most recent book, Cancer, Trauma, and Emotions, a traditional medicine path to spiritual wholeness. It seems to go somewhere that mainstream oncology almost never goes, which is into the emotional and physiological and psychological roots of cancer, but not in like a soft, feel-good way, in a very deeply evidence-based way. Can you please talk us through that whole concept of the type C personality? What is it, and where did that research come from, and why does it matter in a cancer context?
Sure. So a lot of people will maybe heard of a type A personality, right? So those are the folks that maybe they're more prone to anger. They may have issues with high blood pressure, and they tend to be the types of people who are more prone to cardiovascular disease and getting a sudden heart attack. So there was also an attempt made kind of around the 1980s, most notably by psychologist Lydia Temeshuk, to define what would be the characteristics that might be more closely associated with someone who gets cancer. So that became the research around type C personality, which continues to this day. But what they found essentially, starting with Dr. Temeshuk and then onwards, is there's a few main factors that do characterize someone who is more prone to cancer. One of those is a denial of negative emotions. Another is an inability to express feelings, and the third is a high social conformity in terms of compliance. So what does that essentially mean? It's a people pleaser, right? So that's someone who is usually giving a lot of themselves and not having either really good boundaries or knowing when to say no. It's almost like they're hyper permeable. So this describes me. I'm totally guilty of this. And now, it's not to say that obviously every person who gets a cancer diagnosis will identify with these characteristics, but more often than not, these are the ones that tend to fit too as well. So it is a bit of an introspection point, right? Do these things really define me? And what do they mean in terms of how I show up? How do I relate to the world around me? How to relate to my own self-care, right? These are the things that kind of matter in the end. They're not just mystical descriptions of what a person is. I mean, they really do define how a person relates to their own body, their own health, their environment.
I remember Nick often telling me that most of his cancer patients had trouble with boundaries. And one of the things that he would try to do is establish the boundaries. And it was very difficult when you're in like a long conversation with a patient. I mean, his meetings, his patient interactions would sometimes go for 2, 3 hours long. And they always wanted to know all about his personal life, and especially right when he got married. So he said this is why he had to remove all the pictures of us from his office, because it just led to so many conversations that crossed the boundaries.
Yeah. There's definitely the tendency to want to deflect, right? And so as opposed to really hyper focus back on your own health and, what's going on with you, for sure.
So let's discuss ACEs, which are adverse childhood experiences. So, for listeners who aren't familiar, what does the ACE research actually show about the relationship between early trauma and later disease?
Yeah, so this was a joint effort by the CDC and Kaiser Permanente. It was data that was taken from 17,000 adults between about 1995 to 1997. And so what they looked at were 10 categories of traumatic experiences. And the whole idea here is when they interviewed these adults and looked at the kind of experiences that they had that were traumatic, they did them by category. So what that means is even if you had, let's say, psychological trauma once, that's a check mark for that box. Doesn't matter how many times that it happened to you. If it happened at least once, then that is a score of 1. And so we look at different kinds of trauma: psychological, physical, sexual abuse, spiritual trauma, on and on. So of these 10 categories, if you had an ACE score of 6 or higher, you would be more likely to die 20 years earlier than someone who had an ACE score of 0. In addition to that, also twice as likely to die or to have a cancer diagnosis as someone who has a zero. And so the three things they really looked at, they focused on cancer diagnosis, heart disease, and addictions. Those are the three that are more likely to occur with someone who has a higher ACE score.
So then, how does unresolved trauma create physiological environments where cancer can develop? I mean, not just emotionally, but biologically at the cellular level.
Yeah, that's a great question. So this is a tricky one, and I'll tell you why. There's a reason that I split up a book specifically about stress as it relates to cancer and a book that's about trauma. The reason why is stress is in some ways a lot easier to discuss. It's easy to measure. We can measure someone's cortisol levels. We can measure heart rate variability. We kind of know how stress is affecting the body, and it's easy to quantify. Trauma is not quite as easy, and we just talked about an ACE score. So aside from an ACE score, maybe someone having a type C personality and or diagnosis of PTSD, that's really all we have to go on in terms of relating trauma and correlating it with illness. So it's a little stickier in terms of correlating it to a biological effect. Now, having said that, we definitely have animal models that put an experimental way, for instance, mice in a position where they are helpless, right? They can't escape, like a shock, for instance. And that would be considered a trauma that, because of their inability to cope with it, has a certain biological effect. So in animal models, we can definitely see clear DNA damage from putting them in certain situations that would be rendered traumatic. Having said that, too, even within animal studies, of course, we can't traumatize one cohort and not the other to really truly understand this question. That's unethical. But we can see, for instance, is looking at, there's actually fairly good evidence behind ovarian cancer and seeing women who have early trauma, for instance, that how that dovetails into an increased incidence of ovarian cancer. So there's a signal there. Having said that, here's why I really rely on my native court of traditional Chinese medicine, because this is where we have a lot more to say. And so I'll put it just briefly in these terms. We think of trauma as, I guess maybe I'll differentiate it from stress. If the pond of your calm that's still is disturbed by small little pebbles day after day, that's chronic stress having its influence, right? Trauma is a bit different. It's like throwing a big boulder in that displaces water. So you need a fundamentally different approach to trauma in the sense that you have to put water back in. And so from our perspective in traditional medicine, we think of trauma as causing a kind of shock to the system, right? There's almost like this little bit of a soul loss associated with it. And we do think in those terms, spiritually speaking. And so that has a different effect that creates the seed of illness in the body, that other things can come to bear later on that can then develop into a full-blown disease. So the signal is there within the research literature, but then traditional medicine also has this vantage point that can give us more of indication of how this can really shake the body up in a way that where illness can become fulminant.
So your book also introduces therapies like EMDR and somatic experiencing. For a cancer patient who's never heard those terms, Brady, could you just explain what they are and why do they matter more than traditional talk therapy alone?
Absolutely. So I'll break them into two categories. So one approach is a top-down approach, and traditional talk therapy and maybe to some extent EMDR fall into that category. So these are things that are really dealing with how we think about trauma, how we process them, what are our memories around them, and so really having a kind of a cognitive approach to talking through and reframing trauma, right? And the outcome of something like that is post-traumatic growth. It's being able to talk about something and say, how have we maybe perhaps grown stronger because of the trials that we have endured. The second approach is a bottom up, and that one's a bit different. So bottom up is, where do I feel lodged within my body the traumatic thing that has happened to me, and how do I process that differently than just thinking about it? Now, that has several advantages. One of them, if unfortunately, if a child experiences trauma before they're verbal, right, they don't even have the words to express what happened to them. And so for them, it's almost like they have to have more of a somatic awareness behind the thing that happened in order to process it. And so therapies like, you know, like dance, Tai Chi and yoga, Qigong, somatic experiencing, these are all more body based somatic therapies that help to kind of gain an awareness of what you're feeling, how to work through it. And so that has an advantage that but you're not necessarily talking through and maybe even reliving an aspect of trauma. You're just trying to release it for the kind of the tension that it holds within our very being, right down to the fascia, right down to the bones.
Well, I can share my own little personal EMDR experience. I had severe PTSD after Nick died, and I could not forget the experience and the image of being on the floor with him in the bathroom. And so one of the doctors on our board, who's a psychiatrist, recommended that I try EMDR. And he explained that it's this rewiring. And I thought, there's just no way I'm going to ever be able to release the trauma of seeing him on the floor. Well, EMDR worked. And it didn't take that long, but now I can actually have that image and I see it differently. And it doesn't give me nearly the traumatic reaction it used to. So for those of you who are listening, and just one little example of how something like EMDR can actually help you deal with your trauma.
Yeah, and thank you for sharing your story. And my advice to people really is try different things. I discuss in my book several different therapies in each of those two camps. And some people might be drawn to one more than the other. Try different things. You should know within a few sessions and be really upfront with hopefully the providers as well about what expectations are. Try it, see how it works for you. You'll know. I mean, like you just expressed, the benefits will be clear.
So this is something that I want to bring our listeners into directly because Dr. Gonzalez understood this. He never believed that cancer was purely a nutritional or an enzymatic problem. He believed the nervous system told the whole story, and that emotional disruption was a critical piece of what broke the system in the first place. So, Brandon, do you see that pattern in the patients that you've worked with?
Yeah, absolutely. I mean, if nothing else, just the stress of a cancer diagnosis, and then put that on top of the stresses that were probably there prior to the diagnosis, is this compounding influence. And this is something we call allostatic load within the stress literature. It's this kind of one on top of the other, this wearing down. And the word that will be very common to you and maybe to many of your listeners is terrain. What is the terrain of the body? How is it being worn down? And how does that shape our resilience? So ultimately, it is a question of what is the collective action of all the things that we're being exposed to, both carcinogens from our environment and then the stresses within our internal experience that are coming to bear in that moment. Yeah.
So, Brandon, your second book, Cancer, Stress, and Mindset, that's where you talk and you move past trauma and you get into the present, like how we're living now. And what that ongoing experience of stress does to the body that's trying to heal. So I'm curious, most people understand that stress is bad, but you go much deeper than that in the book. What does chronic stress actually do to the autonomic nervous system? And why is that specifically dangerous in a cancer context?
Yeah. So, as I mentioned a little bit ago, there's these direct consequences from chronic stress, right? So I talked about the little pebbles disturbing the pond. But think of those in terms of those little pebbles being like little insults to the system, right? Whenever we're stressed, our body has to deal with that some way. And one of the ways it does that is by releasing cortisol. It's this stress hormone that comes out of our adrenal glands. And it's a helpful hormone. We need a fair amount of it to get through our day. It has a natural rhythm. But when it's elevated day after day, night after night, It can disrupt sleep. It can cause dysregulated blood sugar. These are all things that can, inflammation can run away. These are things that collectively, again, shape the terrain of the body in terms of its, immune resilience, and in terms of how the body is able to detoxify. This is a major factor. But even more so in some ways than the direct consequences. I think about so often when I consult with patients, what are the indirect consequences of chronic stress? How do we cope with that? Well, the two biggest ones tend to be smoking and drinking, right? And those are direct carcinogens. So even just from the perspective of, yes, I'm trying to mitigate my own stress in my life by having these bad habits. Well, guess what? I mean, from a cancer perspective, that's one of the worst things you can possibly do. So not only are you adding to this collective burden on your body from a direct perspective, what's happening biologically, you're also adding this toxic insult from the outside as well. That also shapes our dietary decisions, right? People making bad choices. It also affects, and this is why I tie in the mindset piece specifically, it affects how we show up, right? What are the decisions we make around our own healthcare and our compliance with them and sticking with it for the long term? Stress tends to erode all of those things. So from many different angles, this is why we need a kind of a deeper dive into, it's not just stress causes this response. It's what is it doing, again, holistically to the body that's having this effect.
I like that word terrain. It's as if, your autonomic nervous system, it's not background noise, it's the actual terrain in which the cancer is either going to thrive or it's going to fail and you're going to heal. So, as our listeners here know, the Gonzalez protocol is built on the autonomic nervous system and specifically on restoring the balance between the sympathetic and the parasympathetic activity. But, Brandon, from your clinical perspective, what do you see as the most common ways that balance gets disrupted in cancer patients today?
Oh, I love this question. And it's so important. It really cuts to the heart of it. So I will answer it from the Chinese medicine perspective. So you might know it's called the Tai Chi symbol. It's composed of yin and yang. There's the swirl of black and the white and the dot of the opposite in each of them. And so that represents this duality of being. So we have this yin component, which is the internal, and the yang component, which is the external. And where those two meet for me is the art of medicine. But I think it really is a great way to describe also not only just disease and how we contract disease, but also specifically cancer. So yes, there are internal and external components of disease. But as it applies to cancer, when someone asks me what is the cause of cancer, they just, throw it out there as this big question. Of course, I mean, there's a lot of answers to that. But I prefer to break down that question. I want to get a little more nuance. So when someone asks, what is the cause of cancer, I actually prefer to think of the question, how we get cancer and why we get cancer. So the how is very straightforward to me, and that's the yang, the external. How we get cancer is exposure to carcinogens, right? And that might sound a little bit like a cop-out answer, but it's pretty much straightforward. A carcinogen, by definition, is something that causes mutagenesis in our body. And then from that mutation, cancer is likely to develop. But that doesn't explain why person A exposed to, let's say, said chemical gets cancer and person B does not. And so that's the second question of why people get cancer. And that's the yin, that's the internal experience. In Chinese medicine, it's very clear on this point. They say that, all internal imbalance in terms of how disease develops in the body derives from this kind of repression or suppression of emotions. And so I simplify that for a Westward audience by just saying stress and trauma, of course, the two subjects of my books. But it's the gestalt of all those things. It's the stresses that we're exposed to day in, day out. It's the traumas that leave an imprint in our body. It is the like we discussed, like a type C personality. What is the underlying constitution of a person when they meet those chemicals or those carcinogens, right? And it's all of those things collectively that really do flesh out terrain. And terrain's not just, we have this big push for terrain just being things like the microbiome and the healthy immune system. Those are really important things, don't get me wrong. But where those interface with all these other, maybe more subtle, maybe more emotional, mental components of who we are as people in the world, as beings, spiritual beings, this to me is really, again, framing out what it means to holistically understand cancer and how it's affecting the nervous system.
So, in your book, you write about mindset. And I want to handle that really carefully because I've seen patients use positive thinking to bypass fear and grief and anger, everything that they need to process. Well, what's the difference between genuine mindset work and toxic positivity?
Yeah, spiritual bypassing, that's totally a thing. It's real for sure. It's interesting that you bring this up because, now I'm 20 years into private practice and 10 years into remission. And so I think a lot about this. And in some ways, it's really changed even the trajectory of my career. I've studied more theology, and currently I'm in a program for spiritual direction just because I want to understand this more, this point. And so now I'm increasingly interfacing with patients and asking questions along these lines to really see where they're at. And I will tell you a couple things, and this is both from my personal experience and then also speaking with a lot of cancer patients. I think two things really, really do have to come up from within in a cancer patient. And one of those obviously is to come full circle in terms of understanding their own mortality. And in some ways, cancer kills people one way or the other. Now, either they physically die from it, or they die to the life that they were previously living. I think a lot of people have to massively change their life in one way or another once they get a cancer diagnosis. It is a wake-up call like nothing else, right? And so I feel like in many respects, the patient who is beyond the toxic positivity and is really truly grounded in this mindset piece, those are the patients who are actually have come to a place where they can be okay dying from cancer. That is like the ultimate mindset shift. If they can say, I can be at peace succumbing to this, but I'm still going to try my hardest, that's like this double-edged sword, this laser focus that I think you really need. And the second one, I think, is just falling back in love with the world. I mean, that sounds so simple and Pollyanna-ish, but it really is true. I mean, I think we get beaten down by life and we lose touch with what our soul purpose is, right? And life purpose, I mean, that's like a blue zone thing, right? That's just like health in general, right? Why are we here? And so for a lot of people, I think if they can just find the magic again and become enamored with life, whatever that means to them, those are the things that are way beyond just it's all going to work. Let's be positive about everything and really just redefining themselves, right? Who are they going to be as a more empowered individual after this cancer diagnosis than before, right? And if they do that, if they can maybe use cancer as a teacher, boy, they're going to have a whole different outlook on life, really, truly.
Well, Dr. Gonzalez wrote extensively about the autonomic nervous system in his book, Nutrition and the Autonomic Nervous System. He believed that every element of his protocol, the diet, the enzymes, even the detox, was ultimately in service of restoring autonomic nervous system balance. And what you're describing here with stress and mindset is really the other side of that same coin. Does that resonate with how you think about it?
Yeah, it absolutely does. Again, if I go back to this idea of yin and yang, internal and external, right? Carcinogen exposure, or more broadly, environmental medicine, and then the internal experience of a patient and the stress and trauma. Those are the two biggest levers I think that we can pull in terms of disease in general, but very specifically cancer, because of how that causes this profound dysregulation of our nervous system. Absolutely.
So now we're going to go into a territory that makes a lot of people uncomfortable. Not because it's speculative, but because it's inconvenient. We are all bathing in electromagnetic fields every day. Our phones, our Wi-Fi routers, our smart meters, and the research on what that does to our biology is not as reassuring as the industry has led us to believe. So, Brandon, for someone who's never thought about this, what exactly are EMFs and what kinds are we most exposed to? And why should someone with cancer, or really anyone who's trying to prevent cancer, care?
Yeah, I think you introduced this properly because this is where I become very unpopular because I'm going to start talking about taking away our toys potentially, right? Or maybe changing our relationship to it. So at least give me that and maybe be open-minded. Yeah, so EMFs are things that we are always exposed to. I mean, if you look at back from high school physics, this idea of electromagnetic spectrum, from visible light to infrared to the universe having gamma waves hit us. These are things that we've naturally evolved with. But the new kids on the block are starting with electrification, with AC current, magnetic and electric fields coming into our homes and offices, and then moving into the microwave band of radiation, which includes things like Wi-Fi and our cell phones and cell towers and all the smart devices that connect our home now these days. And so these are the newer exposures of non-native or man-made, artificial frequencies that we're increasingly being exposed to. So the term for this is electropollution, right? And the problem is not any one of these things that I can tell. The problem is the proliferation. It's one on top of another and how we're scaling them up, quite frankly, in a way that we're all pretty much lab rats at this point. So we've been told that individually, maybe these things are safe, but we don't know as collectively how safe they are. And that story is played out many times before, right? In terms of even just chemical exposure, maybe individually that one chemical might be okay. But how is that one chemical on top of this chemical on top of that exposure and so on and so forth? So this is this broader umbrella of environmental medicine. And so those main EMF exposures, AC, electric, and magnetic, voltage transients, which are these higher harmonics that can come in on our power grid, and then microwave radiation or radio frequency radiation. This is what we're being exposed to increasingly now that's having this increased effect on this body burden that we've been discussing all along.
Well, this is a really important conversation, so we're going to dive a little bit deeper. Brandon, can you explain what does the research actually show in terms of the mechanisms? And what I mean is, how does EMF exposure contribute to cancer formation at the biological level?
So there are 4 corroborating lines of evidence that I identified and document in my book. So I'll go through them one at a time. The first one is just epidemiological evidence, right? So this is just looking at humans, let's say using a cell phone for X amount of minutes per day for years on end. Now, there is a little signal in there already, and that is with more than 10 years of exposure, we're seeing this little blip of an increase of glioma, which is a brain cancer, also acoustic neuroma, and then salivary gland tumors. So on the same side that a cell phone is being used. So the signal is there. What I will tell you about this category is we're on the front end of the research curve. You take something like cigarette smoking, it's patently obvious to everyone that cigarette smoking increases incidence of lung cancer. And the reason why we can say that with great confidence is because we're on the other end of that research curve, right? We have decades of epidemiological evidence plus mechanistic research that proves that. So the signal is there, and we're going to have more that comes out in the years to follow. But right now, we're on the front end of that research curve. But know that that's one line of evidence. Now, the second, if that is true, do we see that experimentally just looking at, human cells, exposing them to EMF? And do we see DNA damage? And the answer to that is yes. That goes back to the early 90s with Dr. Henry Lai. And then furthermore, Dr. George Carlo, who was, he headed up the Wireless Technology Research Project. And he showed pretty definitively, they looked for basically chromosome damage by the measurement of micronuclei. So you expose, in this case, let's say, human blood cells, you blast them with radiation. Can we measure the presence of the micronuclei that show up in a test tube? And the answer is yes. So it is causing some kind of damage on a cellular level. If that's true, then what is the mechanism behind it? And that's our third line of evidence. And here there's several that's been proposed. And I can't say any one of them has risen to the top as being the absolute mechanism. One of them is melatonin suppression in the body. That seems to probably play a role because melatonin is an antioxidant, right? And that might play an even increasing role in brain cancer as we're exposed to cell phones. Another one could be just a cellular breakdown in general, for instance, of the blood-brain barrier. Another one's called the Fenton reaction, which is an iron oxidation reaction. And a third one that was introduced by Dr. Martin Pall was an increase of tissue calcium levels. Very specifically because we have these components of the cell membrane called voltage-gated calcium channels. And so there's a way that it disrupts the calcium-magnesium balance within the body, to speak of the nervous system, right? So there's a lot going on there with all these different mechanisms that possibly are coming to bear. And the fourth one, do we see evidence within animal studies? And the answer to that is also unequivocally yes. The National Toxicology Program's own research on this, specifically with rats, in the early, this is like 2016, 17, 18, was showing an increase of, showing clear evidence of certain kinds of cancer risk with these rodents, glioma, adrenal gland, heart tumors as well.
So, for somebody with a cancer diagnosis who's already dealing with so much diet, treatment decisions, emotional work, Brandon, where do you ask them to focus first when it comes to EMFs? And what are the highest impact changes that don't require gutting their entire life?
Yeah, I mean, the first thing I'll say is I tend to really, I let my patients lead in that regard. So I really want to hear from them first what I think the low-hanging fruit's going to be and not try to overwhelm them. Because we don't want fear to be driving, the decisions that we're making. But for a patient who's motivated, who's educated, who wants to really take positive steps, I think the most straightforward, easy things to do is, what are the things that you are exposed to that you have control over? Now, maybe you can't control how far that cell tower is outside your house, right? But the strongest signal is probably the phone that's right in front of you. And so I have a cell phone. I'm not a Luddite, right? I use one. But it sits in airplane mode probably 95+% of the time. And I only make it operational to check messages a few times a day. Other than that, I listen to podcasts like yours on it, for instance. So I have a cell phone. I have a very, what I will call a healthy relationship with it. It's not constantly operational on my body. As far as my computers, both at home and at work, they're all hardwired. We have Ethernet connection for all of them, so I'm not relying on wireless. If that's not possible for you for one reason or another, the easy thing to do is if you have to rely on wireless, at least turn it off at night. You can even just buy a timer from the hardware store so it shuts off around bedtime and it turns on again when you need it sometime in the morning. So at least you're not exposing yourself day in and day out. And then probably the biggest one for people who don't have landlines anymore, I still do, but for people who don't have a landline and only use a cell phone, please don't have it operational under your pillow, for goodness sakes, or even by your bedside stand. Just put it in airplane mode then. So at least it's not constant. And if you need it in the middle of the night for an emergency, you can quickly take it out of airplane mode and dial if you needed to. So that's probably the simple, easy ones.
Well, the Gonzalez protocol includes a really serious detoxification component, coffee enemas, supplementation, the works. Brandon, do you think of EMF mitigation as a form of environmental detox? And how does that fit into a larger picture of reducing the toxic load on a healing body?
So yes, it's definitely one factor, though I hesitate only because when I talk about this subject, I don't want people to think I'm a one-trick pony in the sense that, EMFs is the cause of all cancer, and that's the hyper thing we need to, focus on, right? So I will say that it's one story of a larger story, again, of environmental medicine. And it's an important one, but it definitely fits within the grand scheme of the things that we're being exposed to that we have control over. And so I think a bit in terms of, yes, where are the environmental exposures? But then there's also even resentment is like a poison to the body, right? So there's the emotional piece getting tied back in. So I don't want people to be, again, afraid of their environment, but I definitely want them to be smart about it, right? And so by being mindful of that and plugging in these different details and starting wherever you are and what is, again, the low hanging fruit is probably the best way to proceed.
Well, we believe very strongly in addressing the whole environment of the patient, not just one thing. And Dr. Gonzalez was not just treating a tumor, he was treating a body that had been compromised by everything that it had been exposed to. Well, now, as we've done in previous episodes, I'd like to bring in Dr. Nicholas Gonzalez himself to explain his thoughts.
The human body, as speaking now as a biologist and as a physician, was not designed to deal with the explosion of EMF activity in the environment. It's not just in the air, but in the ground, and that's New York City, in the land, in the sea, everywhere. There's EMFs everywhere. You can't escape it. It's in the apartment buildings. The smart meters are in the apartment buildings. And this affects us. We are ultimately an electromagnetic field. Everything that happens in our body is a series of chemical reactions that are electrochemical reactions. Nerve transmission is electricity. That's how it happens. The way we survive, the way we live, the way our brain works is through electricity. The conduction of electrical impulses through nerve axons is how we live. And that's all electricity. We have an electric field around us. 20 years ago, conventional scientists would laugh, oh, we don't have an electricity. It's like they forget their first year of physiology where they talk about the electromagnetism of nerve impulses. You can measure that now. Correlian field is not just some mysticism or crazy stuff from alternative doctors. It's real. We're an electromagnetic field. And if you don't think that all this electricity, which is all new, hasn't been tested, hasn't been put through clinical double-blind studies to see whether it's safe or not, is safe, it's a big risk, and we're all taking a risk. One of the most common problems in my practice, and it's gotten worse in recent years, I've been in practice 27 and a half years, and I can see the changes in my own professional lifetime. One of the biggest issues now is insomnia. Even people who aren't cancer patients always have anxiety, but even people who aren't cancer patients will come in with their biggest complaint is sleep. They haven't slept well in years. They can't fall asleep. They wake up in the middle of the night. And melatonin is produced in the pineal. It's a wonderful hormone that's derived from the amino acid tryptophan through serotonin. It's very complex, but it's a wonderful hormone that's basically the sleep hormone that sets the sleep cycle in humans, and it's really very, very critical. And one of the problems with EMFs that I found, and I believe this to be the case, seen some research, is that EMFs disrupt melatonin, which shouldn't be that surprising. The pineal, which sits in the middle of the brain, is a very small gland, but that's where melatonin is produced. And it's very responsive to light. It actually operates based on light. When the sun sets, normally, we're designed that when the sun sets, we should go to bed. The pineal starts pouring out melatonin, and melatonin has a sedating effect. Not only does it have a sedating effect, it has a documented anti-cancer effect. In fact, there are clinics in Europe, conventional clinics, that will use 40 up to 80 milligrams of melatonin a day. A normal dose for sleep might be 1 or 2 milligrams. They're using high-dose melatonin effectively to treat cancer. It not only has a cancer protective effect, which has been documented particularly for things like breast cancer, but it has an anti-cancer effect and is being used in treatment regimens for cancer. Now, one of the problems with EMFs is it disrupts the pineal. And again, it shouldn't be surprising because the pineal is light responsive. Light is an electromagnetic energy. That's what it is. So the fact that EMFs are not going to disrupt the pineal is, it's logical neurophysiologically. We would expect EMFs to disrupt, if anything else, the pineal, which exists to be sensitive to light. As the rays of light decrease, as night comes, the pineal turns on and sends off melatonin. Well, EMFs can mimic light. And the light that actually is, when the sun rises, we wake up because all light, whether it's synthetic, artificial, natural, or synthetic, gives off a blue wavelength. You can't see it, but all light has a blue wavelength that stimulates the wake-up center in the brain and shuts down melatonin. Now, blue light is an electromagnetic field. That's what it is. It's electromagnetic energy. Although it's called blue, you can't even see it. EMFs work like blue light. And they basically directly stimulate the pineal like the blue wavelength and turn off the pineal, shut down melatonin production, and disrupt sleep. And people will sleep lightly, or I have patients that they'll sleep 2 hours a night. It's because they're not producing any melatonin. Why? Well, they were on their computer all night, which gives them from the light, the blue light, but also the EMF, which works like a blue light. And that will disrupt the pineal and the production of melatonin. And it's increasing their cancer risk. There's no question that low melatonin levels are associated with increased levels of cancer, particularly hormone-dependent cancers like breast or prostate cancer. So there's no question that the EMFs are having a profound effect on the pineal, and as a result, a profound effect on sleep patterns. I mean, insomnia is epidemic. The costs of sleeping pills in the U.S. is in the billions, and it's among the most highly prescribed drugs. And what's the reason for that? It's the melatonin disruption. What's interesting is some of the newer drugs like Lunesta are actually trying to mimic the normal melatonin production and encourage melatonin production, because there's a much easier way of doing it, but it's not prescription. You take melatonin. Why take a drug to stimulate melatonin production when you can take melatonin? Or an even smarter way is to try and avoid EMFs, particularly late at night when you want to go to bed, because that's going to have the same effect as blue light and turn off the pineal, stimulate the active centers in the brain as if it were daylight, and you're not going to go to sleep. EMFs can have the same effect as full sunlight, even if you're in a completely dark room. That's why the sleep experts, even conventional sleep experts, tell people if you want to sleep well, keep all the electricity out of your room. Even conventional sleep center specialists, who notoriously are 100 years behind everything, are starting to tell patients you got to have no computers in the room, no iPhone, you can't be on your iPhone. The reason is not only the blue light from the light of the screen, which will stimulate the active centers, but the EMFs work like a blue light and shut off the pineal, shut off melatonin.
So let me just ask, what would you say to his patients and to the patients who are now working with his protocol today through our certified Gonzalez doctors? What would you want them to know?
Yeah, I think the central message, and this is the thesis of my very first book, is that non-native electromagnetic fields are a potent human carcinogen. Full stop. That's it. Now, to the extent that they are, at what exposure level, over what period of time, is what's up for grabs. We don't really know how that story is going to play out. So it's like saying, well, maybe this pesticide is a carcinogen. Are you okay with having a small amount of it in your yard? Are you okay with having a large amount of it in your yard, right? So most people would probably look at that and say, yeah, I want the least amount possible. Well, I think that's kind of the precautionary principle that we should also be applying in EMFs. Now, they're a part of our world. It's hard to avoid, just like it's hard to avoid a lot of carcinogenic chemicals. But if we, again, are applying this precautionary principle, how can I minimize my exposure without driving myself crazy? How can I minimize that to the greatest extent possible? To me, as a cancer patient, that's my takeaway, right? Now, everyone's going to be a little bit different. Everyone doesn't want the party to end. So for them, if they have not had any health crisis and they want to be connected 24/7, that's their choice. But for someone who's had a stage 4 cancer diagnosis, who is super careful about the choices that I make, yes, I absolutely minimize my exposure.
So Brandon, let's pull this all together, because what you're describing across your 3 books isn't 3 separate topics. It's one unified argument. And what I'm hearing is that cancer is not an isolated event in the body. It's the outcome of a system under pressure from the past, from the present, and from the invisible environment that we live in. Now, you've had the opportunity to meet Dr. Nicholas Gonzalez personally at a conference. I remember you telling me this. Can you please tell our audience about that? What was he like? And did anything he say actually stay with you?
Yeah, it's funny. I looked it up in preparation for talking with you today. It was 2009. He was speaking at a Wise Traditions conference in Chicago. I'm in Southeast Wisconsin, so I attended his lectures. So this is pretty early in my private practice. This is before I was ever diagnosed with cancer. And so I attended his lectures. And then, of course, I had the pleasure of having dinner with you all at the banquet that followed. And so, my memory was that I got to meet 2 Dr. Gonzalez's. The first one was during the lecture, which here's this really erudite, fast-speaking New York City guy who just laid it all on the line, right? He just told it like it is, and there was no stopping the freight train, right? It was this information just kept coming out, right? And we're all just frantically writing it down. And then there was meeting him at dinner, which was, there's more like this quiet introvert that came out, right? There was this, there was a softer personality of someone that was very compassionate and was very wise at the same time. So it was kind of fun to see both those sides within probably a 24-hour period. Yeah, And I guess what I remember most of all was just someone who he didn't care what people thought. He wanted the information to be out there. It wasn't about how popular, it wasn't about how conventional the information was. If this was going to help people, Dr. Nick was going to tell that story. So that was my main takeaway from meeting him.
That is so Nick. The other story I remember from the Weston A. Price conference was he'd given his talk, and then we were sitting at the head table for dinner. And, you know, Nick was always really humble about his accomplishments. So like you just said, it's different sitting with him at dinner. He's not going to go on and, rattle off everything that he's done. Well, here we were sitting at this award ceremony at the head table. And Sally Fallon, who runs the event, she got up on stage to introduce the person who was getting the Integrity in Science Award. And she was saying such wonderful things about the winner of this award. And I remember Nick looking around the room, trying to figure out who was she talking about. And then she said Nick's name, and he was floored, so shocked. I had to push him almost to get him to go up on stage because he almost couldn't move. He was so surprised. Well, Brandon, if you had to describe the ideal integrative cancer program, one that truly addressed the whole person, what would it include? And what is most often missing in what patients are actually offered today?
Yeah, in terms of the second question, any understanding of the terrain would be my short and sweet answer to that. And to your lovely question of how I would design, an integrative protocol. And I say this not to flatter you, but I think a great starting place absolutely is the Gonzalez protocol. And because, not only do you have the benefits of the enzyme therapy as a direct anti-cancer agent, but you have a very strong emphasis on both the terrain from a nutritional standpoint of what strengthens the body, and then also the detoxification component. Now, I just want to hone in a little bit on the nutritional component because I think this is super important. There is so much airplay to researching and putting energy and effort into diet that's going to, somehow kill cancer. And I actually think that's the wrong approach. And I think Dr. Gonzalez intuitively knew this. When I talk to my patients about diet, I tell them it's so much less about trying to figure out if there's this magic bullet for diet in order to kill cancer. And I think you should be way more focused on the diet that nourishes you, that feeds you, that balances your immune system. And I think that little switch mentally is another thing that patients lack. It's so much more about attacking the cancer and less about what is nourishing and feeding me. And so again, that's something that's pretty intuitive and implicit within the Gonzalez protocol. So I would say that is a starting place. Plus, in my ideal world, I would love every cancer patient to have a mindset coach, someone who's really diving into the psychospiritual component. And then finally, also the third member of the team would be someone who's skilled in environmental medicine. And I'll tell you, the ones who are really picking up the banner there, it tends to be a lot of naturopathic physicians these days who are really tuned into the environmental piece. So those three components, the terrain, the psychospiritual, and the environmental, to me, that's the perfect blend.
Well, thank you so much for giving us a couple plugs there. And I believe you, given everything that you said today. So you're an acupuncturist with deep grounding in traditional Chinese medicine. How does the TCM framework understand the relationship between emotion, energy, and disease? And why does that ancient model hold up so well against our modern research?
Yeah, I'll tell you the number one reason. A little while ago, we were just going on about yin and yang as these kind of two phases of disease, internal and external. But there's something even prior to that. We say in traditional Chinese medicine that all disease has one cause, really. And that cause is an imbalance with nature and natural rhythms. Right? Everything that is downstream that we can talk about, carcinogens and nutrition and all this kind of stuff, are really at their core in imbalance with nature and natural rhythms, right? How we're showing up and applying ourselves and what we're being exposed to. So in some ways, that is not only just the core of it, But it's also the beauty of Chinese medicine of saying, now knowing that, what are all these different ways we can look for the evidence of that imbalance, right? And so it broadens your horizons. It's less about being hyper focused on this one little nuanced cause and saying, if we take a step back, what are these main fundamental root causes that downstream are causing those things? To that point, and you said this beautifully earlier in introducing one of the questions, I think of the tumor as being the symptom, not the disease, right? It's what has showed up because of all of these systemic imbalances within the body. So when you think in those terms, right, and that's where the theory of Chinese medicine as the oldest extant form of traditional medicine really shines, because it's saying think outside the box in terms of how we are really being exposed to things and how they're affecting us on a deep level.
Well, now I'm really going to put you on the spot. For somebody who's listening right now, who's in active treatment or supporting somebody who is, what is the one thing that you wish everyone with a cancer diagnosis knew?
Ooh, that's a big question. I think probably more than anything, what I want them to hear is really take your time. I know there are definitely instances where someone gets a pretty major diagnosis and they feel like they have to rush into treatment. But that's not often the case. And right, and by the time a tumor does form in the body, it's usually there's been this imbalance going on for years, if not decades. So what I would love for a person to hear in that situation is really take your time, breathe into it, think it through, and really find a path forward that empowers you. So for instance, if I have a patient who's recently being diagnosed and they come to me, they're going to have a lot of decisions to make. And there's going to be a lot of options laid out for them. And in some respects, I'm less interested in what path they choose. I mean, yeah, I have interest. I would love for them to adopt an integrative model like what I purport. But let's just say if there's a person who, for whatever reason, they just want to go full-blown conventional oncology, they want to get chemotherapy, and they just want to relegate me as an acupuncturist for treating the side effects of the treatment, right? Maybe I'm going to be treating neuropathy with acupuncture, which it does very effectively. I will back their play no matter what. So my role, I feel like, is to be supportive, but also to pull out of them the thing that restores agency within them, right? What is the thing that's really, truly going to empower them that they can get their whole head and heart behind? That matters to me more than anything, right? What I don't want is someone waffling. I don't want someone who is in this indecision stage. Do I do this? Do I do that? How about that? And they're researching 5 different things, and then they're constantly switching protocols in terms of what they're doing. That's the kind of chaotic internal state that really is not going to produce really lasting, deep healing. So for me, it's coaching someone to get into the zone of really, truly getting into a quiet place, listening to their intuition. Where is the teaching within this that can make me a stronger, more empowered person? And if I can restore that agency with them and they're off and running, that's the ideal scenario of a patient engagement. So I would just say to people, take your time and find your path forward, not through disease, but to health.
That is super helpful advice. Nick used to always say that patients need to pick the treatment plan that they believe in, because that's going to be the plan that they actually stick with. And we just did a podcast the other day with one of our other doctors, Dr. Sarper-Diller, where he talked about the consistency of actually sticking with the treatment is what is most noticeable in the long-term survivors. So thank you for sharing. Brandon, this has been one of the most layered conversations I think we've had on this podcast, because what you've given our listeners today isn't just information, it's permission. Permission to look at cancer as something more than a tumor. Permission to take their emotional history seriously as medicine. Permission to address the stress that is running their nervous system into the ground. Permission to look at their home, their phone, their bedroom, and make different choices. And I want to name the thread that runs through everything you've shared today, because it is the exact same thread that runs through the Gonzalez protocol. Dr. Gonzalez built an entire protocol on one foundational belief that the body has the capacity to heal if we address every system that has been disrupted: nutrition, enzymes, detoxification, and yes, the autonomic nervous system, the terrain. What Brandon is offering through his 3 books are evidence-based, clinically grounded research. It's the emotional, environmental layer of that same truth. The trauma that rewired the nervous system, the stress that keeps it in dysfunction, the radiation that loads a body already under siege. You cannot separate those things from the tumor. The Gonzalez protocol understands that, and now the research is catching up. Well, as we wrap up here, Brandon, can you just let people know where can they find your books and your work?
Thank you, Mary Beth. They're available pretty much through all online retailers, but the central hub for all my work is brandonlagreca.com. You can go there. There's access to my books, to my blog. I write a blog article every month, and then you can also there sign up for my newsletter, which I just do once a month, curated newsletter about what I'm thinking. And if you want to just hop straight to my blog, just kind of read what I've been writing these days, it's empoweredpatientblog.com. But the parent website, brandonlagreca.com, will get you there as well. So thank you very much. I appreciate you, Mary Beth.
Thank you. Thank you for this wonderful conversation. We'll make sure that all of those resources are listed in our show notes. So here are my practical takeaways from everything we heard in today's conversation, and 3 things that you can do this week. 1, address and examine your emotional history. If there is unresolved trauma, whether it's from your childhood or otherwise, that you have never properly addressed with a qualified therapist, that is not optional in a healing context. It is medicine. Secondly, audit your sleep environment. Tonight, take your phone out of the bedroom. Turn your Wi-Fi router off. This is the single highest impact EMF change that you can make, and it costs nothing. And third, notice what is running your nervous system, not your tumor, your life. What is keeping you in fight or flight? And what would it mean to begin to change that? Not as spiritual bypassing, but as genuine physiology. These are not small things. These are the things that sit underneath everything else. And that's what Brandon's work reminds us of. And that is your way back. So, folks, if today's conversation opened something in you, a question, a recognition, a moment of, I knew that, but I just didn't have the words for it, try following that. Share this episode with someone who needs to hear that cancer is not just a physical problem, that healing is not just a biological event. And if you want to go deeper, Brandon's books are linked in the show notes. Cancer, Trauma and Emotions, Cancer, Stress and Mindset, Cancer and EMF Radiation. Until next time, I'm Mary Beth Gonzalez, and this is Your Way Back.